I like my little floating pumpkin there.
Yeah, that's what I was about to say. I love the promo. I love the intro. It is nice.
Yeah,
I like
that
that.
was fun to put together. And then for the one that I used for the slumber party on Saturday night, because we tend to do the naughty cards, and so I have a disclaimer at the end where once it goes through all the motions, and then a little black screen will show up and say some content is explicit language, contained. So not for children's ears, so to speak.
Yeah.
But welcome to whoever shows up. See, that's what happens when you don't even get a chance to promote. Everybody's probably saying, "Oh, I thought Sherry's party wasn't until tonight."
Right,
The
right.
other thing. This is regular business. This is me and Isaac hanging out doing our normal thing, and I'll be back later. So, but I liked the topic that I forget now. So it was somebody in chat that suggested this, wasn't it?
Right. I can't remember who suggested it.
I can't remember who it was either, but it was how to vet doctors when you want to change providers, or if your insurance company changes
Right.
I've worked for companies that have changed insurance companies in the middle of a year, and suddenly your current doctor isn't in the new echelon of doctors to use, and you're running around like crazy trying to find somebody to switch over to. So yeah, that can be kind of a little disheartening, I guess. It's definitely a pain in the backside trying to find new doctors. And if you're new to an area, it's really hard to figure out who's, because I know a lot of people tend to go by word of mouth. Oh, Dr. So-and-so is really good. You should go see her. You should go see him. But if you're in a new area, so you're like, well, I don't know who's good or who's bad, who has a good reputation, that kind of thing. I know when I lived in Phoenix, my insurance company picked your main doctor for you.
Really?
You were assigned to someone, so that's who you went to see. And then if you had to see specialists, you would go through that doctor. And so I would always tell them, just find me somebody with a sense of humor that doesn't have a God complex, and I'll get along with them. And so he scored pretty much. Hi, ethnicity. He scored pretty good most of the time on that. So most of my doctors he found for me were really good doctors. And but yeah, it could be a real headache trying to go through that. I like you had you sent me a list of options to go with. Of course, Hypnicity, you're the only one here so far, so you got us all to yourself. The rest will stumble in when they realize that, oh, hey, she's doing something now, not later.
Yeah.
Of course, what we were just talking about, asking for recommendations, going by word of mouth.
Right.
Who's a good doctor? Who do you steer clear of? Just like I know in the pain management world, when you run into people that are looking for a new pain management doctor, their number one question is, are they willing to subscribe pain medication, or do they want to treat you like an addict if you ask? kind of thing. And so, yeah, that can be a real kind of hold up on trying to find a better doctor or a surgeon. I mean, hi,
Right.
Carrie. So, I mean, when we first,
Kathy.
I first looking, hi, Kathy. When when I'm in Phoenix and when I finally got to where I had to go back to pain management and then to see a surgeon when it really started getting bad with my neck and my back, mostly my neck at that time. I couldn't couldn't do this at all. My whole body would have to turn. And I couldn't turn my head behind me. And I tried asking around for good surgeons, and nobody really knew anything on the kind of surgeon I was looking for. So there wasn't a lot of people I worked with that had any experience. So the first doctor that my doctor sent me to, I was like, yeah, he's not going to work. We need to find somebody else. And so he sent me to the second orthopedic surgeon, and he clicked. He was nice, Dr. Chang. He did neck surgery, and he was funny. He had a really good sense of humor about it, you know. And I appreciate that in a doctor. It's like you laugh at yourself, man. But hypnicity, depression that's probably something that Isaac can speak even better on, is finding a therapist to accept people that deal with depression. I just know from the experience of my husband was clinically depressed, or what they termed as clinically depressed. And so, yeah, it made it difficult a lot of times to when he would kind of go off into one of those episodes of trying to pull him out of it was the hard part. And then once you kind of got him out of it, he'd be good. He'd cruise along for a while, no problems. And then something would trigger and he'd go right back down into that depression. And so that can be really, well, I'm going to let Isaac talk about the depression part. Like I said, I just have a little bit of personal experience, no clinical experience with that.
Usually, well, not usually, but sometimes depression is different. Some people are just have their mood is not high anytime. So some people, they may have like seasonal affective disorder, bipolar disorder. There's so many things. It's just that you have to get, I guess, with the right person to make a diagnosis. Some people don't
Right.
want to take medicine. They want to, do behavioral things, which, you have to respect that. And some people will only take medicine and won't do behavioral things. It's
Right.
it's best in combination. If from what I can see, anything that we face as human beings is about personal growth. How am I willing to grow? Am I willing to change? Am I willing to do something different?
Yeah.
That's what I think. And finding a therapist, and you say I don't want a drug solution. Actually finding a therapist that is open to that
Hi,
tell
Dr.
them what's
Ann.
going on, and then you work together.
Yeah.
Hello.
Dr. Ann comes to us from the future. She's tomorrow. She's in New Zealand.
Okay.
And she's a professor. She works with quantum mechanics and stuff like that. So
Oh, wonderful. Wonderful.
Miss Brainiac, we did a show
Hmm.
together yesterday. She was blowing my mind with some of the stuff. It's so
It's Monday in
interesting, that
New
kind of
Zealand.
stuff. Yeah.
Oh, wow.
Um, Monday, yeah,
Hmm.
you're at work.
Hmm.
ADHD, yeah, my son is ADHD, plus he
Hmm.
battles PTSD,
Hmm.
which can cause severe depression. And
Hmm.
I'm sometimes when the PTSD kicks in, it can get scary because he almost sounds suicidal at times. Now that hasn't happened for
Hip,
well
hip,
over a year now, since he finally was able to get a job in music doing what his passion is. That
yeah.
really flipped
Hmm.
the script for him,
Uh-huh.
Um,
Hypnicity says
yeah,
she needs a doctor who understands woo-woo. Uh,
absolutely.
there are a lot of them out there, but they're not going to say it if you don't say anything.
Yeah,
And usually the
yeah,
first few words is, I'm more spiritual, and you'll start to hear more and more.
yeah.
Hmm.
Because it's something that can hinder their careers if they're not careful how they
Hmm.
put it,
Right. Hmm.
uh, because you get so many that kind of just,
Hmm.
poo-poo that away and it's not
Yeah.
real.
Hmm.
And that can be difficult to,
Hmm.
it's like you're kind of treading on eggshells to walk
Hmm.
around the topic to
Hmm.
see if the person picks up the bait and gives you a response to let you know, oh
Uh-huh.
yeah, okay, they understand where I'm coming from. So
Yeah.
um
Hmm.
that can be a little difficult. um Hypnicity, wow, oh my god, girl.
Hmm. Yeah.
Yeah, I mean, I live on pain medicine, as y'all know. I would not
Hmm.
function without it.
Hmm.
But you can also ask my family. I am extraordinarily, almost fascistly strict on my medications. It's like
Hmm.
it always stays locked up. I
Hmm.
only take a pill when my alarm goes off and says it's time to take a pill. Even if
Hmm.
I am hurting like hell, I will not take a pill until my
Hmm.
alarm goes off and says it's time for the next dose.
Hmm.
Um, I just because I've seen too many people kind of go off the cliff on that, to where,
Hmm.
and it just requires more and more and more and more.
Hmm.
Uh, where my pain management doctor had explained to me,
Hmm.
you figure out when are your peak times,
Hmm.
and then you want to take that medication 30 minutes before you hit that peak time.
Hmm.
That
Hmm.
way you're not killing the pain, but you're managing the pain.
Hmm.
It's still
Hmm.
there, but you can function,
Hmm.
and that's kind of the whole point of pain management,
Hmm.
is learning to manage it. It's not going away. Um, and so once he kind of explained that to me and I understood the concepts of what he was talking about, it was a lot easier than to be able to manage what it was
Hmm.
I was needing to do when it came to
Hmm.
myself.
Hmm.
Um, but it's hard when, and now you've got the government that's gone to an extreme with opiates
Hmm.
of cutting them back. I mean,
Hmm.
it took years for my pain management doctor and I to find the right mix for me that kept
Hmm.
me kind of just cruising along at
Hmm.
a fairly even pace.
Hmm.
And then the government stepped in and was like, you can't prescribe more than 3 doses a day.
Okay.
Doesn't matter what their pain level is, doesn't matter what the issue is, no more
Hmm.
than 3 pills a day.
Hmm.
Pharmacy
Mm.
can't even dispense it for more than 3 pills a day.
Mm. I didn't
And I
know
was
that.
taking full, and like it's all that much more.
Hmm.
Um, and so they had to cut me back, and
Hmm.
ooh, that was hard that first month. And I went
Hmm.
back and I said, okay, something's got to give. This isn't working. My levels are now back up in the stratosphere. And
Hmm.
so they had to up the milligrammage on the 3 a
Hmm.
day that I do take. And that
Hmm.
was something I've been avoiding doing for years. Was
Hmm.
I was at a very low dose, and it was like I was trying to keep it as low
Hmm.
as I could keep it
Hmm.
without having to up the milligrammage on it,
Hmm.
because I know that that can be a slippery slope as well, but I wound up having to take that route because of what the government did. They kind of created the problem of the opioid crisis, and now they're overcorrecting with, instead of using a scalpel to figure out what's wrong and fix it, they just took a hatchet to the whole thing, and chronic pain patients are suffering because of it. And there are a lot of pain patients that maybe don't have to go to opiates. They can go to other means, from steroid shots to chiropractic to uh, physical therapy stuff. I've tried everything. This was like our final thing was like, okay, this is what we're left with. You're going to have to deal with, so I've already tried everything else. So, and it's hard to get people to understand that because it's not something they can see. It's not like looking at somebody with a missing leg or a missing arm and, oh, I get it. You're handicapped. I understand. With depression, I think it's the same way. It's people are really good at masking what's going on inside by wearing that false face to the public. And, and then when they do something, people are like, I never would have thought they were that depressed. I mean, they never acted depressed. They were always so happy and friendly and blah, 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 blah. It's like, yeah, in public, but not in private. So,
Yeah, you can have situational depression, but some people have depression that is hereditary, it's in the family, and that can be difficult. It can be difficult to accept because we all think that we should not have to put effort into being happy. But there are certain things that we can do to sort of, well, my thing is self-care. You take care of yourself and you're probably going to be at a better state if something happens so that you can bounce back from it. But yeah, depression is
yeah,
real.
yeah, it's hard. I feel for your hypnicity because I've had friends that didn't move through it, and it wasn't, well, I'm not going to talk about what happened with them, but it wasn't a
Mhm.
pretty thing. Um,
Mhm.
so I get it with how
Mhm.
difficult that can be.
Mhm. Yeah.
So here we go. All right, I just used my last 5 memberships to gift people with. We get 10 a month that YouTube lets us give away for like a month trial. And then
What's that?
to become a member on my channel, I have membership now. That's right. I haven't talked to you since I turned it on. Um, you can be a bebe turtle or you can be a Cajun crawfish. And
Oh, okay.
one is like $4.99 a month and the other is $9.99 a month. And you get extra things that I'm going to be doing for
Mhm.
members.
Mhm.
And then if you have any levels that are under 5 a month,
Mhm.
YouTube will let you gift 10 memberships a month where they cover the cost for 1 month
Mhm.
membership.
Mhm.
And it lets somebody try it out. And then if they like it,
Mhm.
they can keep it. And if they can't afford it or don't want to keep it, they can just let it expire. It's up
Mhm.
to them.
Mhm.
Um, I didn't even know they did that until another one of the readers who just turned his membership on was telling me about it. I'm like, wait a minute, what? We can do what? I didn't know. I don't remember reading that in the instructions they sent. Um, so yeah, we got some people now that and I have no control over who they gift. It's like random pick through their algorithm. I don't know how they pick, but I'll be able to do it again after November 1st. So I've been trying to hit it up with do it on the shows when it's more of my regular people that are already on all the time. So, but we see you, MLR. You're not blocked. She's been blocked from a couple of channels. That's happened to me, and nobody can figure out why. I mean, just like getting unsubscribed, at least every other month, go check your subscriptions and make sure you're still subscribed to the channels you want to be subscribed to, because the algorithm will just up and kick you off for whatever reason. Who knows? I was on a live stream. I wasn't on air, but I was in the chat with Marina, and I'm a member of her channel, a paying member. Plus, I'm a moderator. And I was at work, and I was just hanging out in the chat. She had some guests on, and I happened to look over and realized I wasn't subscribed. I'm like, how can I not be subscribed when I'm a member and a moderator for this channel? But somehow the algorithm kicked me out from being subscribed, and I had to resubscribe, which is free, y'all. So you can subscribe for free. And so welcome to the new members. We got new members now. Yay. Who else did it pick? I don't even know. I don't even know who it picked. Okay. I guess I'll figure that out.
Oh, it'll just pick them randomly.
Yeah, the algorithm will just, whoever's in the chat will just go through and randomly pick people in the chat and give them a membership. Which is kind of cool.
Yeah.
I just don't have control over it. Like with the ads, I have no control over the advertising, the ads that you get hit with. That's completely YouTube. We have no control over that. Okay, let's see. Let's go back to this. Another step to vet for a new doctor. Check with your insurance company. Yes, very, very important to check with your insurance company. Because you don't want to move to a new doctor and find out after the fact that they're not covered. That could be expensive. Let's see. What else did you have on here? Use a medical search engine. Yes. And I am actually going to put that in the chat. Okay. Sorry. All right. I'm going to put this in the chat. Some options that y'all can use to help find a doctor if you're looking for a new doctor. A couple of search engines that Isaac sent me. So that'll be good. And let's see. A doctor finder tool. I didn't even know such a thing existed.
There's one on the American Medical Association website. You can put in a doctor's name. I'm not sure what that's about. They just sort of like tell what the doctor does. And some people, they may have to go to another doctor because their doctor moves away or passes away. So
or
things like
quits
that.
accepting a certain insurance. I had that happen with my eye doctor. That I had a regular eye doctor, and then they quit taking some of the insurance because they were having hassles getting paid. And they wound up losing a bunch of patients because they were no longer covered, and there was quite a few of us, from what I understand, had got and find new doctors, and it was was a real pain in the butt because,
Mhm.
you're in the middle of treatment or something with your doctor, and now suddenly you got to find somebody else
Mhm.
and start over from scratch.
Yeah. Yeah.
Yeah, that's not fun.
Mm-mm. Mm-mm.
You're right, Dr. Ann. I do hope that they finally get rid of the profit system for healthcare.
Mhm.
I mean, granted, healthcare workers, doctors, nurses, admins, whatever, they need to
Mhm.
be paid decent money, but they're not making money off of the current healthcare system. It's the corporate CEOs that are making all the money.
Right. Or the, what do they call them?
The
The group
board
of people that
members.
no, the group of people that get together and they'll buy the hospitals and drain all the money off the hospitals and, what are
Yeah,
they?
yeah, yeah. Um, um,
Hmm,
Mitt Romney is one of them. What do they call him?
is it?
Yeah,
They're like
he's
a,
crap. It's like right there on the tip of my tongue.
I don't know, they pool all their
Hedge
money.
manager. They're called
Yes,
hedge
yes.
manager.
Hedge fund.
Yeah, a hedge
Yeah.
fund manager, because they'll go in, they'll buy a company, they will suck out all of the profit, all of the money out of it, borrow heavily against it, and then declare bankruptcy. And so the people in the company get screwed out of retirements, anything along those lines that go with that company. And it's just
Mhm.
the top dogs that walk away with money in their pocket and they don't have to repay the loans. And
Well, it's about our system, I think. That's the way we're set up. You can to be
hi,
honest with you,
Hugger.
we can sell anything, and we don't realize it until things start to go bad. So,
Yeah,
I think it's our system. It's good if you're
absolutely.
using it in the way that, you know,
It's meant to be used.
benefit.
Yeah.
Yeah, but when you see the loopholes and you say, "Oh, I can sell this lake, and or I can sell all this farmland," whatever. It's not a it's a good system until it's not.
Right. Right. There's so many there's just so many little things like that wrong with the current system
Mhm,
that just makes it harder for everybody to function
mhm,
through it. I mean, hi
mhm,
Clarence. Um, let me see what else. Consider the doctor's credentials.
mhm,
Look for board certifications, uh, where the doctor completed medical school, residency training, where they passed exams. Yeah,
mhm,
I mean, most doctors, at least down here, they put that stuff that, they've got all their certificates like framed and it's on the wall in the exam rooms when you go for an exam.
mhm,
You've got
mhm,
their credentials on the wall. I don't
mhm,
know if that's just a Louisiana thing or if other states have their doctors do that too. I know the doctors I had
mhm,
in Arizona didn't do that.
mhm.
Um, they didn't post their credentials on the walls, so I don't know if that's a state thing or I don't know.
Yeah,
But
usually when you have a license, you're supposed to display it prominently so people can see. Because the reason
ah,
why they say that, because sometimes they ask you for your license back. But that's a whole different story.
okay, okay. I didn't even realize that was an issue.
Mhm. Yeah.
Cool. Hi Joy. Hi Leah. Uh, yes, Leah, you were the one that dubbed us Sir Isaac and Lady Sherry, and we liked it so much we decided to keep it.
Yeah.
And now we put that down for our names. So,
Every time.
every time. That's right.
Hmm.
Leah's the one that crowned us. So,
Hmm.
I could even well, this is for the party later. I've got my tiara to put on. It takes too long to do all the rest of this. So I was like, okay, I'll just have to do sneak peek. I'll get a sneak peek for the costume tonight. But everybody's thanking Leah for it.
Yeah. Yeah.
Oh my goodness. Okay, what's some other stuff there? Senior
You can,
counselor.
well, you can always go to usually each state has a board. You can go to their board and find the names of doctors uh, that are practicing in the state. Uh, Even if a doctor comes into the state, they have to apply for a licensure and they'll have them on their register. Some companies or organizations, they'll ask you to, like, I worked for a hospital once. Well, it was a group of hospitals, and we had to, our physician was in the hospital clinic. So it didn't always happen that way, but I think people are trying to save money on the insurance, and they say that's why they say you go to this doctor, that doctor. But you can
Right.
sometimes you can say, can I keep my doctor, like out of network doctor? And sometimes they'll let you do that. It's
Yeah.
just that you have to ask, and
Yeah.
and whoever asks this, even if you have a doctor who they've been disciplined, you can see if the doctor followed the recommendations to take
Mm.
to get themselves back under control. And usually, if they did, they're probably a better doctor, I would
Hi,
say.
Jules. Yeah. That's interesting to know. I didn't realize that they did it and here I am. I've worked in the medical field for 35 years.
Hmm.
And there's still stuff I'm learning every day about it that is like,
Hmm. Hmm.
wow, I had no
Yeah.
clue that
Hmm.
that's how they did it. I know I worked for a medical testing lab in Arizona,
Hmm.
and it would be anytime a patient or a nursing home facility would change providers or
Hmm.
insurance companies, it would throw everything in a tizzy of
Hmm.
can they still get their patient stuff tested at our lab? Or
Hmm.
if our lab added on an insurance or took off an insurance, sometimes we would lose a whole facility to go draw blood from because none
Really?
of their patients had the other, or
Okay.
they were all on that particular insurance that got dropped.
Hmm.
So all of that stuff I know can make a big difference
Hmm.
as far as 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 far as how it affects the patients,
Hmm.
how it affects the clinic. I mean, most of your hospitals now have their own walk-in clinics.
Hmm.
Um, I know the Catholic hospital here,
Hmm.
Our Lady of Lourdes,
Hmm.
um, they have several like breast centers around throughout the area.
Hmm.
That's their own breast centers you can go to for your breast exams and everything. They have their own walk-in clinics that you can go to. Um, Instead of having to make an appointment with the doctor and go into the doctor and da da da, you could just
Hmm.
go to the walk-in clinic if you're on their system, and it's cheaper. I know I'm with Blue Cross Blue Shield at work, and
Hmm.
Ochsner just bought out the other hospital system here in town, which was Lafayette General Hospital, which been here forever and ever and ever. But Ochsner is now like our main provider that we go to for our health care with our doctors,
Hmm.
our clinics, all that stuff.
Hmm.
And they have clinics all over town. And they have a thing within the Blue Cross Blue Shield that is, it's part of your insurance that you're already paying for. You just have to sign up for it. And you can sign up anytime during the year. You don't have to wait till it's that time when you
Oh, okay.
renew. And you can go to any one of their designated walk-in clinics free of charge. You don't pay a copay, you don't pay testing, nothing. You just show up, you show them your ID and your insurance card, and they take care of you.
Oh, that's nice.
It doesn't replace seeing your regular doctor on a regular basis, but if you fall down and break your arm, or if you get a bad cold like I had or something, instead of having to wait 2 weeks to get into your doctor, you could just go to the walk-in clinic, and you don't pay any money up front. It's all in the insurance system, the way they work it. Which that's a big help. They were some of the first ones to set up the COVID testing when they started finally doing testing down here for everybody, especially after President Biden got into office, because that's when he really pushed and got the monies designated for hospitals and clinics and doctors' offices and stuff to start doing the COVID testing and offering the testing for free for patients. And because in the beginning, a lot of people, they were charging anywhere from $25 to $50 a test to go in and get tested. And if you tested positive, well, you had to go back in a week and test again before you could go back to work. So that's $50 to $100 coming out of your pocket. People were complaining like that's too much money. And then when Biden came in, he cut all that to where it was free of charge. And he started the thing with, you could contact, I think it was the post office, and you would get free home test kits.
Oh,
you
yeah.
could go to
I
your
remember
local
that.
pharmacy and pick up free home test kits. So like I said, when I was in Arizona, I worked for a medical testing lab, and yeah, we did all kinds of things like that, where when the government would come in and pay for something, then we could blast it out to everyone in the network, say, go in and get your shot or get your test or do this or do that. When H1N1 hit back in the early 2000s, our testing lab was one of the first labs to get the vaccine, and they vaccinated everybody that worked for them free of charge. They didn't charge anybody. And and that was all because the government was paying for it. That's when Obama was in office. So funny how depends on what party's in office as to when you get health care.
It is.
And when it's more expensive.
It
Yeah,
is.
I think you can still order free test kits, Joy. I think you're right. I'd have to go in and double check that. I had some left from the last time they were sending out free test kits. So it was expired on the box, and I called and they said, no, they're still good. I'm like,
Yeah,
okay.
yeah. I remember that.
Let's see. Consider the doctor's credentials. Okay, we talked about that. Were they with school, training, whatnot? Consider the doctor's office. Ask about the doctor's office policies, such as how long it takes to make an appointment, if they offer same-day appointments, how long patients have to wait. I know here, and when I was living in Phoenix, the insurance I had there, every time you would go to the doctor, they would send you a survey. How long did you wait? How long did it take to get an appointment?
Yeah.
Once you
Mhm.
got in the back, how long did it take for the doctor to
Mhm.
get in and see you? That kind of thing.
Mhm.
They were very conscious of time, not taking too
Mhm.
much time, because
Mhm.
when you're sick, you don't want to sit at the doctor's office for 2 hours waiting for your turn to go see the
Mhm.
doctor. You'd rather
Mhm.
be in bed.
Mhm. And I think the big thing is like if you're in the marketplace and you're getting insurance, it's like you got to take a lot into consideration about
Yeah,
copays and deductibles and things like that. So I think that's a big issue, and you can even call like your doctor and ask them, "Do you take this?" Before you make decisions.
right. Yeah, yeah, yeah. Because depending on the doctor's office will depend on if they charge copays up front or do they
Mhm.
bill it to you, or um a lot of insurance companies now offer what they used to call a cafeteria plan. Now it's
Mhm.
considered a flex plan, where you can get a like a regular debit credit card,
Mhm.
and you tell them, well, I think I'm going to spend $1,000 next year for my medical
Yeah.
expenses,
Mhm.
and they will preload that card in on at 00:01 a.m. on January 1st. That card is preloaded with a full amount of money, and you can use
Mhm.
it for copays, medications,
Mhm.
glasses, whatever else that they include on it.
Mhm.
Um, and they pay it by they take a small percentage out of every paycheck
Mhm.
that pays that amount. So depending on how much you say you think you're going to spend will depend on how
Mhm.
much they take out of each check.
Mhm.
Um, Now that's really nice if you can get that, because
Mhm.
then you don't have to try to make appointments around your payday, or have to wait to take your kid into the doctor if they're sick because you don't get paid for 3 more days. You gotta wait till your
Mhm.
check comes in, that kind of thing.
Mhm.
Um,
Mhm.
when you have that flex card, you just go and you put it on the card and it's taken care of.
Mhm.
Um, there's even some over the counter stuff you can use it for. So
Mhm. Mm.
that's kind of cool. Um,
Yeah.
let's see. How an everyday person. Yeah, hypnicity. Yeah, I get
Mhm.
you there.
Yeah. Yeah.
Yeah, I've never worked for a health insurance company, but I've had to deal with health insurance companies.
Mhm.
And I just know that if y'all are in the process of getting Medicare, don't get a Medicare Advantage policy, because that literally null and void your Medicare. That's
Really?
yeah, it will null and void your Medicare, and basically you're just paying for your own insurance. And
Wow.
they can do all kinds of things that Medicare companies aren't allowed to do, and a lot of
Mhm.
it is big ripoff. They make a lot of promises, make it sound like, oh, you're going to
Mhm.
get this and this and this, and yeah, no. I learned that the hard way working for the medical field. Was stay
Mhm.
away from
Mhm.
those.
Mm.
So, but yeah, it's very important to do your research.
Yeah.
No, let's see. You had
Mhm.
the medical search engines. I posted those in the chat. That
Mhm.
PubMed,
Mhm. Mhm.
HealthGrades, WebMD, ZocDoc. Never heard of that one.
Mhm.
Um, you can even check with some of your bigger insurance companies. Most of the time, they give you fairly accurate information.
Mhm.
Um, uh, Consider the doctor's compatibility. You put on your list here, Isaac. That's what I was talking about from the beginning. I've always looked for doctors with a sense of humor. I don't want somebody with a God complex. It's like,
Yeah.
let me know you can laugh at yourself.
Right.
Check the American Medical Association website. I didn't think about that. Yeah, AMA. Check with your state medical board. Your state government should have a link or information on who's licensed to practice medicine. Look up your state's physician's health program. What is that? That's a new one.
That's for the physician's health program, or physicians who have like maybe had issues in the workplace and had to receive some type of treatment. It could been like could have been for like personality things, or could be for addiction. And usually those people are monitored, and they're usually better than they were before the treatment, because people are going to be looking over their shoulder for a long time.
Gotcha. Okay. Dr. Ann asked a good question. How does AI fit into this? I would say from a cybersecurity point of view, which is kind of where I got a little bit of knowledge of, just because I have several professors that's what their research is on, is cybersecurity, and AI is, it's a lot easier today to fake your credentials than it used to be. So you have to be, we now have grad students that are like faking their entry exams, having AI, Chat GPT, write their proposals to get into your grad school. And we've even had a couple that have tried to do it when presenting their thesis or their I can't think of the other one. There's the master's thesis, and then there's the one for the doctorate. And you have to be, I've heard professors going off about
dissertation.
Dissertation, thank you. I've had professors I've heard go off because they read something a student turned in, and then they have to take it to the director and say, yeah, this was in a journal article 5 years ago.
Wow.
I know that because I wrote it, or something like that. It's like, if you're going to cheat, be smart about it. Don't cheat with that professor's work. Don't think that they're not going to recognize what they wrote.
Well, that's the whole part of cheating, is that you don't want to put any work into it. So whatever comes up.
You just write. Yeah, you just put up whatever comes up. But it's only happened a couple of times, and our university really cracked down on it with, like, you get caught with that, doing something like that, and you're out. There's no second chances. So that is sad. You're right, Leah, because what is the point? I guess that comes with the whole concept of cheating. What is the point of using somebody else's work? What if they're wrong? Then you just flunked too, because you copied somebody that was wrong. And what did you learn from it? If you didn't, if you didn't study the material, then how do you expect to do the work if you get accepted on a lie? Because now people are going to think that you know what you're talking about, and that you're going to be able to handle the work that goes for that kind of research. And if you get in there on a lie, how are you going to do that research? Your batting is
Share,
negative 1,000. So
share it. I'm laughing because the people that do that, they don't think the way you're thinking. Like
I guess not.
that doesn't even occur to them. They're like, I'm just gonna do this. I'm gonna if
They just
they think
in the
that if
door.
they can fake it that and get past that, they'll they'll cut somebody open. They don't care. If if they were in a medical school. And
Yeah.
that's why they have all these checks and balances.
Yeah. You're right,
Mm,
Hypnicity. The
mhm.
morals and values are not what they were.
You
And
know,
there
I
was a
don't
time when if you gave your word about something, people could stand on that. Oh no,
but
Isaac said this, so I know it's going to be true.
there's always been people who were scammers. Always.
Oh yeah, always, always.
I,
It-
probably even in caveman time. It's like they were given they were supposed to be giving them a smooth rock and the rock was rough at the bottom. Pass it off, It, some people that's just their mentality.
yeah,
But I think when we see that we don't have to address it. We just have to accept it that this person is I don't know. I've worked with people before and I had a supervisor and I told her, I said, Debbie, I said, she was like, these people have to do what they're supposed they have to maintain appropriate boundaries. And I was like, Debbie, I don't think you can teach people boundaries. They're going to either do it or they're not. And
yeah.
she was like, "They have to do it." I'm like, "Okay." But some people you tell them what the boundaries are and they try to figure out how can I get around it.
Thank you. Yes,
Yeah.
that's exactly
Mhm.
it. They try to
Mhm.
figure out, how do I get around it?
Mhm.
How do I not have to check all those boxes?
Mhm.
Um, that can be really, really difficult. Um,
Mhm.
like Mr. Haney on Green Acres. There you go. There you go.
Yeah. Yeah.
Perfect example.
Yeah.
Um, and I'm trying to think of, can you think of anything else that we can impart upon them to,
Mm,
um,
mm, mm, mm. I would say talk to people, not and that's usually what I do, not from the because if you don't talk to a lot of different people, they don't know what you're looking for. But if you put it
yeah,
out there and you just collect the information, not some people are going to say, "Go to this doctor. Don't you go to anybody else? You go, just take in the information and then you decide." That's what I
yeah,
think. You have to have enough information to compare.
right, right. Um, that is so very important to,
Hmm.
especially if you're in an area where you don't know anybody
Yeah.
in that
Hmm.
field, or you're
Hmm.
living in a new area, you don't know any of the reputations there. So,
Right. Hmm.
um, you're not going to jump in and buy the first thing because person A said to. You're going to talk to
Right. Hmm.
10 people before you make a decision. So,
Yes.
I think the same is true for a doctor, and shouldn't it be
Hmm.
even more so because
Hmm.
that's your health we're talking about. Um,
Exactly.
so from mental health to physical health, I mean, it's all the same.
Hmm.
Um, find out who medical workers go to for a doctor. Joy,
Yeah.
that's an excellent, excellent point to make.
Yeah.
Yes.
Hmm.
Because if uh
Yeah.
if you know of other doctors, nurses, interns, whatever, and they go to a particular doctor, well, that should say something right there. So,
Yeah, they have
um,
the inside scoop. They're not gonna tell you, but they have the inside scoop.
and most of
I
them
like that.
can't tell you. They can't tell you, oh,
Mhm,
well, go see Dr. So and so. They could lose their
mhm.
job for that, you know,
Right, right.
especially if it's somebody that's not in their group or not in their
Mhm.
their purview.
Mm-hmm.
So yeah, that's
Mm-hmm.
a good point to bring up.
Years ago, I had to have a surgery, and I went in, and one of the nurses there, I worked with her husband, and she was like, "Okay, we have to give you we have to give you recommendations." She said, "This doctor, this doctor, this doctor, but you're going to this doctor," and I said, "Okay," but basically, she was telling me who to go to.
Yeah,
But I like what Joy said. Ask the medical workers. Yeah, I
yeah,
like that.
very much so.
That that made me remember that situation.
Very much so. I can't think of anything else. I think we kind of covered
Yeah. And we probably better wind
everything.
down on time because you have
I've got to
another
do some.
engagement.
Yes, I do. I got a party in 30 minutes. So
Yes.
let me look here. All right. We'll be back on November 10th, and our topic will be finding a good counselor. Isaac's not available for everyone. He may not be in your area or in your
Uh-huh.
insurance plan.
Yeah,
So
that ought to be
how
a
do we
good.
find a counselor, a good psychologist, or a good
Mhm.
psychiatrist if it
Mhm.
needs a step beyond that?
Yeah.
And what's the difference?
Mhm.
I've had people ask me that too. Well, what's the difference between a psychologist and a psychiatrist? I
Mhm.
usually tell them an MD. That's the biggest difference.
Uh-huh.
Psychiatrist has an MD, and a psychologist does not.
Right.
Um, Hi, J Cat Lady. So yeah, that'll be next time. Next up, I'm gonna wrap this up and say goodbye kind of quickly because I need to go do a freshen up, and my ponytail
Mhm.
is starting to
Mhm.
drag down,
Mhm.
and I gotta go
Mhm.
reposition it. And my party hair is falling out, so I gotta go fix it.
Yeah,
And be
but
ready.
you look so nice in the red, Sherry.
Oh,
I
thank
have to say
you.
that with I said that to Sherry earlier, but I wanted to say it with everybody
He was
here.
like, "Oh, look at you, all spiffy."
Yeah, I like that. The red
You know,
really fits you. It does.
red is a good color for me. Not everybody can wear red.
Mhm. Mhm.
So I discovered it by accident. I
Mm.
wore a red blouse one day, and everybody was like, "Oh my God, you look great in red." I was like, "Really?" Never really thought about it. um, I look good in jewel tones,
Okay.
reds, blues, greens, purples, anything that's like a
Okay.
jewel tone. It
Okay.
just matches my skin tone. Some people look
Okay.
really good in pastels.
Uh-huh. Right,
I guess
right.
it just depends.
Mhm.
So alrighty, well, I will see everybody in half an hour for the Halloween party, and Isaac will not be with us because he's got prior obligations. But we will be back in 2 weeks on November 10th, and we be talking about even something more of his expertise, how to find somebody like Isaac.
Yes, yes. How to
We
find
don't
a
all get
counselor.
lucky and just get introduced to them online and go, "Oh, hey,
Right.
that's how we met." So
Yeah.
all right, y'all have a great weekend, a good week.